The implants in the all-on-4 hurt. What should I do? First of all, implants do not hurt because implants by itself, they are metals, so they don't hurt. We need to understand that if it's going to be on the surgical procedure or if it's going to be on the prosthetic procedure. The only way that those implants might hurt is because you're having a rejection. And if you're having a rejection, probably you're gonna feel the throbbing, or it could be hurting just like a little bit, like if it was pumping, like if it was giving you some pain. That could be the only thing that might happen. Not always, but there has been some cases where you can have that. Now, once you have the rehabilitation, once you have those implants that they are osseointegrated, 3 to 6 months later, well, you're gonna have the screw retained part that is going to be positioned on top of those implants. You're gonna have a connection from the implant, the abutment or the multi-unit to the bar. When you have this type of connection, sometimes on those areas you might have some areas that they're gonna be a little bit more wider and the gum's gonna be compressed. If the gum's gonna be compressed, that can hurt. So once the bar needs to be passive. Once the bar goes passive, you need to feel it. It needs to feel like if they were your own teeth, because they're going to be strong, stable, and they shouldn't have no compression of the gums. Another way that they might hurt is because you have a lack of hygiene and you're gonna have food getting trapped, you're gonna have tartar, and then you're gonna start with pockets. Those pockets that they form around the implants, sometimes, depending on each case, the doctor, what they do is that they remove the bar, and those pockets that you have, they're gonna need to be cleaned. Sometimes you need to recover those implants, or you can just do this surgical procedure, do some bone grafting, and try to preserve those implants as much as they could. But sometimes those implants, they have that problem of the pocket all the way to the bottom, so that's going to be an implant that needs to come out. And then you need to start again. You need to wait, and then you're gonna put again the implants, and then you're gonna restore. But that will depend on each case. Each case is different, and you're gonna find different solutions for each type of things that happens to your all-on-4. That's why that my suggestion is that if you're gonna do an all-on-4, you should get in contact with a doctor that places implants but also does the restorative work, because that way you will have the 360 solution, and no matter if you have problems on the surgical or the prosthetic work, you're gonna have both solutions given by the same doctor or the same office. That's the most important thing, because sometimes they send you to do the surgery to some place or do the restorative work, and then if something happens, they will say it's not my fault or it's not my problem. You should have the full solution. So do your homework, search, watch videos, see testimonials, and find a special doctor that treats you like an expert. And subscribe to my channel to get more solutions so you can have a great layout with that thing that you want, that is the all-on-4. Dr. Arzate, diplomate of the American Board of Oral Implantologists, the ABOI. Thank you.